Hi, Mike. How are you?
I am great. How are you, Paul?
Great. Thank you for coming to talk to us and share with our students if they were to go into the healthcare field, what that might be like. So, could you tell me who you are and where you work?
Of course. I'm Mike Messersmith. I'm HR manager for Oneida Health.
And talk to me a little bit about what it's like to come and work in the healthcare field at Oneida Healthcare.
Absolutely. So, one of the great things about working at Oneida Healthcare is since we are a community hospital and we do serve Madison County and some of Oneida County, you're really contributing to the overall health and success and well-being of all the community members you serve. It's sort of like being able to give back on a day-to-day basis to people you may never meet, but you know that you're having a positive effect on their lives.
Nice. So, what skills would I need if I were to come to you to be successful at Oneida Healthcare? What would it take?
It really depends. Number one, just in a general sense, having a desire to help people and try to make their lives better through just being there to support them, being there to provide care, and supporting the people who provide care. When you start getting into individual jobs, uh, there are some where you require specific licensure, nursing, LPNs, CNAs. They're all great examples of areas where you need specific licenses. But there are a lot of opportunities in the hospital where you don't need that licensure. Registration is a good example. Housekeeping, one of the most important groups of people for our entire hospital's operation. We also have positions called medical office clerks, where you're in our practices and you're providing some of that initial support and intake for patients who are coming in. So it really depends on how far you want to go with your career and what you're willing to commit to it as far as what you need and what you'll get out of it with us.
Great. So, with all of that, there's a whole bunch there. Would I need a high school diploma if I don't need licensure for some of those? Do they require me to have a high school diploma?
Right. We don't always require a high school diploma for a position like dietary or housekeeping, but typically after that, we would require at least a high school diploma. And then as you get into higher, more skilled positions, certificates and licensures.
Right. And then, what is my opportunity for growth if I start out maybe taking people, filling out paperwork, but then I decide I want to get into the healthcare. So, is there room for growth there?
There is, and without sounding like I'm trying to be funny, it's sort of up to you. We have tuition reimbursement, so when individuals are interested in expanding their career and their skill sets, we encourage that. So when they go back to school, we will reimburse a portion of their educational expenses. There are some areas where we will enter into agreements with employees to help them pursue even further education. We have one employee who was a longtime nurse for us, and he is now going on to become a nurse practitioner. And he'll be starting his clinical rotations with us in the summer, I believe. So we've reimbursed a lot of his educational expense. So there are so many opportunities in healthcare from, intake all the way up to being a doctor or even an administrator for the hospital itself. So it truly is a career where if you have a plan and you want to go far, there are resources there to support you. Even you know, personal and professional development as far as growing individuals within a certain job title. We're working on a program now for career ladders where we can grow people within the job that they're in. So if they just want to get more proficient at what they're doing, they don't necessarily have to go back to school, but we're going to support them to develop themselves to be
Nice.
the most effective professional they can be.
So, kind of like an in house education.
Exactly, exactly. So one good example is I mentioned our medical office clerks. If an individual wants to expand their skills in that and become a medical office assistant, we have a plan to get them to that next level. They can get a certification through BOCES, as a matter of fact, to enable them to become a certified medical office assistant. And then from there, they may choose that they want to expand even further and become an LPN. So there are a lot of really clear growth paths in healthcare, and and we're willing to support our employees to get there and develop that way.
Nice. So I want to come and work for your company. What's the best avenue for me to look to see job openings?
Great question. There are a few ways. Most of our positions are kept on Indeed.com, so that's a great, easy way to go. You can also come directly to our website. It's Oneida Health OneidaHealth.org/careers. And from there, we'll have a complete listing of all of our openings. You can download an application and just submit it directly to me. My email and phone number are on there if you have any questions. But either one of those two places is a great start to get information about what's available with us.
And how about social media? Is that an avenue that you guys look into when you're hiring people, when you go on to Indeed? Is there steps where you're going to check social media accounts? And could that hurt somebody from getting a position?
It's not. That isn't something that we do as part of our hiring process. And we wouldn't typically concern ourselves with individuals' social media account, except as far as it would affect our professionalism or their ability to do their job for us. Once you work for us, we would just ask that you abide by a social media policy we have, which provides really common sense and basic guidelines on how to identify yourself and work within the social media world without compromising your position as one of our employees. But no, we don't use social media as a means to disqualify anybody from employment.
Great. And then what, on average, what would I start out earning is it minimum wage, and then as I continue my education, it can grow from there?
Yeah, starting rates do grow with education. Some of our positions do start at minimum wage, depending on the level of skill required. But all of the positions, as we require more education, we do compensate individuals at a higher level. So again, going back to the idea that you can earn as much as you'd like to just by growing that skill set and pursuing those educational opportunities. We'll match them as you grow.
Nice. Yeah. And obviously, nursing field, I would need to have a uniform on, my scrubs or whatever I need. But how about some of the other positions? Is there uniforms or tools, equipment that I should need to bring with me to my job?
There's not. What you do need, we would provide for you, especially right now with the pandemic. We provide all of your personal protective equipment that you would need for whatever specific job you're working in. Any kind of tools or anything like that, we would provide as well.
Great. So I think my questions are good for the students, but what I would like you to maybe share with them is, how did you decide, on a personal note, how did you decide this is the healthcare field that you wanted to get into, and administration and all of that?
Sure. I've had a pretty diverse background. I went to grad school for human resources when I was a little bit older than most of my classmates. Got involved with human resources because I was really interested in how people work together and the systems that people create at work. I bounced around to a few different states and a few different industries, and was always involved with people who were on the benefit side of human resources, and thinking about how that translated to supporting people as employees. It got me thinking more and more about healthcare as an industry supporting communities. I moved to New York State in 2016 from North Carolina, started working at a hospital in central New York, and realized that this really was where I wanted to be. And moved to Oneida Hospital in 2018, and have been rewarded by the ability to support my community members and truly make a difference in people's lives on a day-to-day basis. So, I like to say that everybody who's working in healthcare is contributing to the well-being of our patients or our residents in whatever job that they're doing. In human resources, it just happens to be that I'm supporting that by hiring the best people to take care of our patients and our residents. it's an incredibly rewarding career, and I'm really happy that I made the move to healthcare.
Awesome. Well, thank you for coming in and sharing your story with us and helping us to connect with the students.
Thank you for having me, and I really appreciate it, and I look forward to meeting your students.